Ever wonder why a cup of coffee doesn't hit the same after a few weeks or why certain medications seem to lose their punch over time? Welcome to the fascinating and sometimes frustrating world of pharmacology, where we look at how our bodies fight back against drugs through two distinct phenomena: drug tolerance and tachyphylaxis. While they might sound like the exact same thing, since both result in a medication becoming less effective, the way they happen and how fast they happen are completely different stories. Think of drug tolerance as a slow, strategic adaptation. When you take a medication or a substance like caffeine or alcohol regularly over weeks or months, your body undergoes cellular changes to protect its internal balance. It might physically decrease the number of receptors available for the drug to bind to, a process called downregulation, or it might get incredibly efficient at breaking the drug down in your liver before it ever reaches your brain. This means that to get the exact same therapeutic effect or buzz you used to get from a tiny dose, you now have to continuously scale up the amount you take. Tachyphylaxis, on the other hand, is the body's emergency brake. It is an incredibly rapid, acute onset of tolerance that can happen after just a few doses, or even right in the middle of a single treatment. A classic everyday example of tachyphylaxis happens with over the counter nasal decongestant sprays. The first time you spray it, your nasal blood vessels constrict instantly and you can breathe perfectly. But if you abuse it and spray it repeatedly over just a couple of days, the local stores of norepinephrine in your tissue get completely depleted, or the receptors instantly desensitize to protect themselves from overstimulation. Suddenly, the spray stops working entirely and you are hit with rebound congestion, where your nose becomes more stuffed up than it was initially. To visualize the core difference, imagine a nightclub. Drug tolerance is like the club owner slowly hiring fewer bouncers over 6 months. Because they're changing the club's layout, the change is gradual and systemic. Tachyphylaxis is like a sudden power outage at the front door. The system immediately locks down and stops letting anyone in right now. Understanding this distinction is absolutely critical for doctors and pharmacists. If a patient develops standard drug tolerance, a physician can often safely adjust the dosage upward or switch them to a different class of medication. But if a patient experiences tachyphylaxis, simply pumping more of the drug into their system won't help at all because the biological runway is already maxed out. Instead, the drug must be stopped entirely to give the body's natural chemistry time to reset. Ultimately, both tolerance and tachyphylaxis are powerful reminders that our bodies are not passive recipients of medicine. They're dynamic, constantly adapting survival engines that always strive to maintain perfect equilibrium. If you like the video, subscribe to my channel and I'll see you in the next one.